Welcome back to the Chad Hasty Show on News Talk 95.1 FM and 790 AM KFYO. Obviously, coronavirus, the top news item of the day. And in studio with us this morning, it's been a while since we've had him in studio, a surgeon here in Lubbock for over, 20 years practicing medicine. Also began Operation Hope here in Lubbock. Always good to visit with Dr. John Thomas here in studio. Normally, Doctor, when we have you in, it's about Operation Hope and, all the things that you're doing there. Now we've got a worldwide pandemic to talk about.
That is correct. Usually it's me talking about another country where I'm about to go with cholera or into Iraq or countries where we're going to do medical mission work.
Yeah, and now we're having to deal with this here in the United States. I guess we'll start off with COVID-19 coronavirus. Are you surprised by the spread of this, and how the world has reacted to this, and how easy is it to catch something like coronavirus?
I'm surprised by the reaction of all the countries, and that surprises me because if you look at the swine flu, 61 million Americans were affected by 200,000 people admitted and 20,000 people died. And this is definitely a much more contagious disease. And swine flu started in our pigs in America. And so it was easy for us to track this stuff. So there is a underwriting behind it, is that because where it came from, China, and they are masters of secrecy and lies. So we did not know the exact truth of what this disease could do.
Yeah, you go back and you look at even Dr. Fauci, who has been sitting next to the president, basically all these press conferences. I think he, a month or two ago, was saying, based off of what we find in China, this is not as contagious as as some of the other viruses that we've seen. They were almost treating this as a SARS, as a mild case of SARS almost in China.
Absolutely. And that's what they were saying they were treating, but we were not there. But that's why, the mayor of New York said the same talking point. The governor from New York said the same thing. So that's what they were telling us. So we were very ill prepared. So if you look at January the 15th or so, after the president addressed the ban, there were 430,000 Chinese people left, many from Wuhan to America. Mm-hmm. So these people came in unchecked, unvetted with the disease process, because the big thing is that 25 to 50% of the people that have this disease are asymptomatic. They don't have the fever. They don't have the cough. They don't have the flu-like symptoms. So how do you check those people? You can't. And so they came on to the big international airport like San Francisco, L.A., New York, New Jersey, Seattle. And there's all these places where it's just in Chicago. And this disease has just taken a strong hold.
How easy is this, from what you know? How easy is this disease to community spread, basically?
The biggest thing, Chad, is that it is through the droplets. But the droplets, live droplets in the air, life is very, very short, maybe 30 seconds to a minute, maybe. But it is where hard surface contact areas, like I'm talking to you right now on this microphone and the table. If I was this part on the table like this, it could last 36, 48 hours. The doorknobs, and those are hard places. So an asymptomatic person goes there, and they can spread this thing, and somebody who can pick up these bugs, and you got to get a certain viral load to have the disease process to be initiated.
So is this, let's say you're at a store, or any kind of, place, venue, somebody who, has coronavirus, has COVID-19, they sneeze, they wipe their nose, they put their hand on the table. Somebody comes by within an hour, puts their hand on the exact same table, then wipes their face with their hand. Is that how it's primarily being transferred?
I would say, because I don't think it's somebody sneezing into your nose to get you the disease. It's the contact surface area where you're picking it from your hands and the hand to the mouth. And so being a surgeon, we are known for our sterile zone in the OR. And so what I have advocated on Operation Hope sites and stuff like that. Let's create a safe zone. For example, let's use a car as an example. And everybody sneezes on their elbows, right? But these people go to the gas pump.
Yeah.
And they will grab the gas pump, but you don't control what others do. But my car is a safe zone. So when I go pump gas, and before I get in the car, I wipe my hand down with Clorox wipes or Lysol wipe, and I get back into my safe zone, which is my car. There's nothing there. If I go to the grocery store, I'm not going to go disinfect the cart I'm about to hold and go on and buy all the stuff. All the grocery stuff I bought, I put it not on the seat of my car because it's a safe zone, but the trunk or the floor of my car is where I put it. And so therefore, what I'm doing is that I am mitigating the factors. I'm trying to limit what I can do to the exposure to this virus. And keeping your hands clean, hands away from your face and mouth and eyes is the best way to prevent this disease.
How much, when you compare this to the flu, and that was an early talking point for a lot of people, saying, okay, is this like the flu? Is this deadlier than the flu? It has a lot of characteristics of a flu, but how does this compare to just the average flu over the course of a year?
Because, again, flu, we know the historical perspective of a flu disease. But this one was a new virus that just jumped onto the human person, and it has changed and mutated onto human. So we don't know what the transmission mode was. Once we know that, but we don't know how aggressive this is. And there was no treatment. So a lot of people were treated for flu, but it didn't act like flu. The lungs, they had a lot more pressure in the lungs. They had a lot more fever. I do believe in Lubbock, I have 3 patients that I personally treated had symptoms just like coronavirus in mid-January. These are young, healthy guys, and one owns his own dent shop. He was down for 2 weeks, and he goes, John, I feel like somebody's sitting on my chest, and the fever would not. He was 104, 105 fever. I mean, I did. The flu things were negative. I gave him everything I know, but so I think it's been here.
That's what I was about to ask you, because we come up with this date of like March 1st or whatever it may be. The first case in the United States. We know that they were dealing with this in China at least in December, if not before. People were still traveling to the United States in December, if not before, and spreading this. And one of the questions that we get all the time are people who, and I saw another USA Today article today, was that December cough, COVID-19, was it coronavirus? How long do you think this has actually been here?
As I said, I've had at least 3, 4 healthy people that have never been sick, and they might get mild cold symptoms, and all 3 of these people that are business guys in Lubbock were down. There's one guy, I had to call so many cough medicine. The pharmacist called me and goes, John, what are you doing? This is controlled substance. You can't give him this much. And he said, John, my ribs are hurting. I'm about to have my ribs to break because I cannot control my cough. The only thing control is codeine. And so I do believe it was there, but we had no way to check against COVID-19 because we had nothing to interface with.
Yeah. Do you think that when it comes to testing, in Lubbock, do you think that we've seen enough testing going on to really get a handle on what we're seeing here locally?
I do believe because 50% of the people are asymptomatic. The best test will be to test the antibody of the general population, see how many people were exposed to it and stuff. So I think Lubbock is way far ahead of the curve. There are plenty of facility available to go test. And our mayor has done a great job to enhance the process and shut down. But every time something like this happens, shut down. But how long is the shutdowns?
Yeah. Well, we'll get into that here in just a little bit. If you've got a question about coronavirus, is it safe to get takeout? We'll talk about that when we come back. Is it safe to go to the grocery store? Is it safe to do some of these things? Send in your questions. Text them in 806-680-2790. We'll continue our conversation with Dr. John Thomas. When we come back, we're also going to talk about how Lubbock has done so far and when we can reopen things. I think that's on the top of mind of a lot of business owners out there and consumers. When can we get back to quote unquote normal here? We'll be right back. Dr. John Thomas in studio talking about the coronavirus, COVID-19. During the break, we were talking about the anti-malaria drug that the members of the press seem to make this a controversial issue. But it sounds like in some cases it's working.
Absolutely. And it's hydroxychloroquine is a drug that's been around for 50 years. And chloroquine is a drug that we taken to when I went to Haiti, I take it because to prevent malaria. And so, even from China, there's data that they're saying that they treated people with chloroquine, hydroxychloroquine, and Zithromax, and their disease state was much less than people that didn't get it. So this drug we know, and for disclaimer purpose, I have nothing to do with the stock market. I don't own any share of the company that makes it, but this drug is well known. It also hydroxychloroquine also treats. It's also called Plaquenil. It treats lupus and rheumatoid arthritis. So we know all the side effects. We know all the bad stuff it can do. So it's a well-studied, well-known drug with a history out there. And so it's only the fake media and the people who have created chaos out of this thing. And this drug, there's no other treatment for it. So what is the other side effects? Yeah. So treat the people. And also now with the president's announcement that, this could be used as off-label, people that are medical providers, you can go onto the internet and search for off-label use consent. So there are people coming to your office. You can have them sign the consent. It's a waiver kind of consent, and you can treat them for 10 days.
How does it work in a hospital setting where because we do have some people who are in hospitals here in Lubbock and throughout the country, can they make a request to have that drug used or because some doctors don't want to go there. Some doctors seem like they're okay with it. I know some states have banned it completely, which I think is just wrong. But can someone who's dealing with coronavirus and going through the symptoms, can they request that drug?
Because as I said, like a lot of even the medical, there's so much confusion there, and that's what I'm telling people is that if you go get an off-label consent. So it protects you that, if I, as John Thomas, came as a patient and I need this medicine because I heard, and my dad was exposed to he died from coronavirus. But whatever the case is, I'm exposed. So I want to get treated. So you can give them the consent. They can sign the waiver and then be comfortable treating the patient because there's no other cure because, as I said, 50% of the people might be asymptomatic.
Yeah.
And if you had somebody die with coronavirus, like those, Whisperwood nursing home, there's so many disease, you're not going to lose anything by giving this medicine to them.
Right. Let's see. We had a texter asking if citric acid spray is effective against the virus for on surfaces. Can you use citric acid spray?
Like an acid-based contents to clean, it's just kills stuff because the cell permeability of the virus can be impacted. So I'm not an expert at citric acid, but I'm a big believer in Lysol, wipes and Clorox wipes, and that'd be the best thing to just disinfect. Soap and water be another good way to, wipe your counters down.
Yeah. Soap and water, wash your hands.
Wash your hands.
Yeah. When people go to the grocery store, we see the CDC now saying, on second thought, you may want to cover your face when you go out into public. What do you think about that?
Like yesterday when I rounded the hospital, everybody's wearing a mask. So again, 50% of the people are asymptomatic. What does mask do? Mask will help asymptomatic people to be the spreaders of disease. I don't think it's a great idea to have a mask to prevent from getting the disease. I wear a mask in the OR to do surgery. It's not to contaminate the instruments or the patient with whatever I have.
Right.
And it's not for me not to get something from them. So that's why you would use a mask. And again, a lot of people are saying like the N95 mask is a little more sophisticated, and it can. But if you're not a chronic user of mask, it will lead you to touch your face 30, 40 more times because mask is very uncomfortable.
Right.
It wants to creep near your eyeballs. You're going to pull it down. And so you might be more often opted to touch your face if you're not used to wearing a mask.
It almost seems like it's a double-edged sword having that mask. And, if you if you don't think you're sick, you haven't had any symptoms at all, but you still want to wear the mask to, maybe you think you're asymptomatic and you don't want to give anybody anything. You could be like, hey, I'm being a good citizen here, but it could lead you to touching your face a lot more. And if you touch a surface, that could be bad. I can see why the CDC is not making everybody do this.
That's correct. So we say cough into your elbow, and, that little fabric's going to decrease the droplets out. So the mask does the same thing. I don't believe the mask is what's going to prevent you from getting the disease.
Yeah.
Because the disease is going to be based on you touching your hand to some entity and touching it back to your face, eyes, nose.
Yeah. Let's say a texture. I'm suspicious of a mild respiratory infection that I had 7 to 8 weeks ago. My question is, can I go get tested? If I had it, will I test positive? Am I a candidate for antibody donation?
Well, you can. I think now there's a test coming where you can be tested for your antibodies. So if your respiratory thing was from COVID-19, yes, definitely you have it. But the convalescent plasma transfusion, what they're talking about is that they're taking people that are known had the disease and recovered, and a week to 10 days later, they're getting their plasma to transfusion to people that are actively fighting the disease. And they're on the vent, they're very sick, and they're trying to see what they can do to make them better.
When it comes to reopening things and reopening the economy, what is it going to take for us to get there, in your opinion?
Like today, when I looked at the Lubbock number, we had 3 cases of COVID-19 positive patients as of 3 new ones yesterday.
Right.
And I think we can open everything, but the paranoia and the panic in the citizens of Lubbock is very high. Parents are scared. Kids don't want to go play in the park. So, when opening it up is not going to make, I think it has to come from the highest form of government. If it's going to be Texas, it's got to be governor, not the Lubbock of mayor, because, people are going to be, and it's got to, and the business must be protected.
Yeah.
It means, as we talked about the waiver for the drugs, because if you were to open a restaurant like Chick-fil-A or Shotgun, one person gets sick, they can go sue them. That paranoia is going to be there. So we have to get from the top of the president of the country saying, president of the United States saying, hey, enough is enough. The cure cannot be better than destruction of our economy. So therefore, I'm going to say we're going to open it up. Maybe some place like New York and Los Angeles, some big places where this crime is affected, New Jersey, we might say we're just going to stay hold.
Yeah. You're a surgeon. You're pro-life. You don't want people to get sick. You don't want people to die. You also want the economy to be good. I know that about you. Have we been making the right decisions by closing everything?
I personally believe we have not done the right decision of closing everything, because there are some people's daily wages, even with the SBA loan and the people, the payroll protection payments and all this stuff, it's going to take some time.
Yeah.
There are people struggling today, like North Star Ambulatory Care Center. They furloughed all their employees. But what happens to them? They're single parents. Where do they go to? Mm-hmm. So why? Again, I go back to it. Why is this more different than the swine flu that killed 20,000 people? And we didn't hear anything about it. And I think we need to educate the people that are in more contact with people about how safe we can create ourselves. Like a safe zone, have Clorox wipes and stuff available to wipe their hands, and educate people, like shutting the schools down. And some of the kids are home now. The parents can't go to work because the kids are home.
Right. Can we get to a point where, and maybe it's on May 1st, maybe it's, I hope it's the sooner the better. But let's say May 4th comes around and the president says, we've got to reopen different parts of the economy. Governor Abbott says, yep, you're right. We got to reopen parts of the economy. Is social distancing, and like you said, taking the preventative measures by washing your hands, doing that, is that enough to prevent a groundswell of people running to the hospital and getting sick?
Again, you could go outside and play. You can pick up a sneeze and a cough for a day. But because of the COVID, there is subset of people that can be highly paranoid.
Yeah.
And they will go to the emergency room and they go, every cough is not COVID-19. Like if you look at in the early 80s when the HIV thing was. So we practice universal precaution. We did not have an opportunity to test everybody because tests didn't come back.
Yeah.
And that's where the whole gowning, gloving, all this stuff came.
Yeah. When we come back, we'll continue our conversation for at least one more segment with Dr. John Thomas here in studio. Chad Hasty Show, KFYO. Back on the Chad Hasty Show, News Talk, KFYO. Dr. John Thomas in studio. I want to go back to those who have been hospitalized, those who have been who have passed away. We've seen 4 out of the 5 deaths here in Lubbock connected to the nursing home. What is it with this disease as far as we know right now? And I say that just because, like you said, Dr. Thomas, this is such a new disease. We're still figuring things out day by day. What is it about those with underlying health conditions, those who are elderly, who are at a higher risk of dying?
It's like what is your physiological reserve? So people that have chronic pulmonary diseases like the COPD or asthma or have congestive heart failure where the lungs are not able to function as best. So if you take 25% of the lung function away, they can't breathe. And so they got to be put on a breathing machine or supplement oxygen. And even then, they don't have the enough strength in the muscles and stuff to take a deep breath. So you put them on a breathing machine. So these people on a breathing machine, the mortality, like when you look at, I'm being a surgeon. If I was to do an elective surgery versus an emergent surgery, the mortality and the morbidity. Mortality means that they can die from it, or the complications increases by anywhere to 30 to 50% on any surgeries. And so so when you look at a person that is in the late 70s and 80s with 2-3 other disease process on top of them, diabetes, kidney failure, immunocomp, and these people have very little reserve left for them to fight another disease. And I think that's the reason why you see about 38% of the people that are dying are people over 75.
A texture, I think we've addressed part of this about social distancing and cleaning practices, being able to reopen businesses. If you take all the best practices, we could possibly do that. But they continue, is making people stand in line for hours really safer than just social distancing inside a store.
Like a Home Depot has this where they have tagged the marks where each person should stand. Again, common sense. I went to Food King a couple of days ago to buy some groceries for mom and dad. They're like, mom is 79, dad is 84, 85. And, means I could not get to one aisle with 8 people behind me, and there's no social distancing. So we have to, I can only control me, how close I can be to somebody else.
Yeah.
But some people who are paranoid about toilet paper and stuff like that, they want to rush to it. And I wish we could control everything. But I think if we were to have social distancing and keep your hands clean and keep your hands away from face and mouth, I think a lot of these things could be mitigated and be less.
Yeah. For those who have it and recover, are they immune from getting the virus again? We
are seeing in China right now, there is an upward trend of new diseases. We don't know this new disease for the same people or they didn't completely recover. So there's the immunity short term, but again, we don't know a lot about this disease.
Yeah.
And so I really can't answer that question.
Do you think this is going to be seasonal? Do you think that, and I know it's so new, we don't know yet, but as we get into summer, do you think this is something that could go away and then it picks back up in the fall and winter?
I think it'd be like the H1N1. We haven't seen a lot of the H1N1 disease back since 2008, 2009. And I think we might have a little more of this disease left over for next year, but I don't think this is going to be like the flu that's going to be ever present.
Yeah. When it comes to some of the other, like that we had a listener who texted in about the Z-Packs. Are those good? Are there also any drugs that people should stay away from taking?
Like the early part, they said that you should not take Tylenol,
right?
Take ibuprofen. Again, that, now CDC have come back and said, well, that was, we don't know what the information is. So I would say, like the majority of the treatment for COVID-19 today is you treat the symptoms. If you have fever, take a medicine like Tylenol, ibuprofen, Advil to bring your temperature down. Drink plenty of fluid. If you have cough, you want to suppress the cough. And again, same like flu. If somebody's home with flu, we don't share the same drink, the same food, and you isolate as much as you can. And so again, for those people that have been exposed, if you're afraid, again, as I said, hydroxychloroquine and Z-Pak have shown, even France has the data that is shown. So if you don't believe Chinese data, if you go to the France data, it surely have reduced the days of bad disease on people that got this medicine.
Yeah. Let's see another texture. Is there an average recovery time?
It's a 14-day. That's the reason why initial thing was after we closed the country, a 14-day lockdown to see if we practice everything, what was going to be. But not every state, every city practiced that. And that's the reason why the April 30th deadline was. So you can see now, like if New York has reported less hospitalization, less death. So this 14-day cycle, I think the 14-day is a magical mark it's going to come to be.
Yeah. As we wrap it up, and I'll just ask you as we go, as we move forward, should nursing homes continue to be locked down? Those where, our most vulnerable citizens really are. Should those continue to be locked down for the foreseeable future, in your opinion?
I would, because their tolerance of getting a disease is so small, and 50% of people could be asymptomatic, their loved ones could go them and give it to them. You and I could tolerate a higher viral load to get the disease, but our grandparents might not be able to have that. So I would say yes.
Should they have been locked down sooner here, or is it just something where everyone was just caught by surprise?
Like Monday morning quarterbacks never throw an interception because they see every play.
Yeah.
And so, hindsight is always 20/20. I think, we should applaud this president. He's a business guy. For him to shut down an economy like this, but it kills him.
Yeah.
And there are a lot more people that are of faith praying and, doing our portion of it to challenge ourselves. And I would like to say, 2 Chronicles 7:14, if my people will depart from the wicked ways and cry unto me and repent, I'll heal the land.
Yeah. As we wrap up, final tips for everybody. Keep clean.
The final tip is that, again, I'll go back to it. Like as a surgeon, we have a sterile circle in the OR. Try to create a sterile zone for yourself. If your car, before you get in, make sure your hands are clean. If your kids are playing outside, if they come to the house, first thing they should do is not go to the fridge and grab a drink. It should be go wash their hands. And before you sit down, wash your hands. And so create those things. Your car, clean it, and the trunk and the back seat, should be the floors of the car should be where you put your food from the grocery store. Mm-hmm. And little things like that could do a lot more to make a big difference of this disease.
That's another question that somebody sent in earlier. When you get home from the grocery store, should you wipe down bags? Same for takeout. If you get takeout from one of our great restaurants here in town, do you need to wipe down anything? How does that work?
The person that could be packing your food could have the virus, but it's asymptomatic, so they could cough or they could have it in the hand. So, again, what I say is that any of the great restaurants in town, just put it to the dishes that is clean.
Yeah.
Recreate the safe zone again, and then put it in a big trash and take it outside and wash your hand and eat your food.
But we don't see a lot of, from food to a person getting sick because of something they ate. As far as coronavirus,
we don't know. Because we have some people don't know how they got it.
Yeah.
But it's very, very small amount of people. Everybody, if you look at 155 people have the disease in Lubbock right now, and I think about 85% of these people have known how they got it.
Right.
And some of the people we don't know. That's still under investigation, but some people we don't know how they got it.
Yeah, I think last count was 27 cases of community spread, which, I think for this area is pretty good. Right? I mean, that's a pretty good number.
Absolutely.
All right. Dr. Thomas, thanks for stopping by today.
Thank you, Chad. God bless.
Yeah, good to see you. Chad Hasty Show, KFYO.